India's fertility rate has fallen below replacement level. Here's what that actually means. For decades, India's biggest worry was having too many people. Too many mouths to feed, too many bodies for a developing economy to absorb. So governments ran campaigns, slogans were painted on walls. The message was simple: have fewer children. And it worked. Maybe a little too well. India's fertility rate has now fallen to 1.9 children per woman. For the first time in its history, India is having fewer babies than it needs to keep its population stable. Before we get into why this matters, let's understand what we're actually measuring. The total fertility rate, or TFR, is the average number of children a woman is expected to have over her lifetime for a country's population to stay stable. Not grow, not shrink, just stay the same. That number needs to be around 2.1. Why 2.1 and not exactly 2? Because not all children survive to adulthood and slightly more boys are born than girls. The extra 0.1 accounts for that. This number is called the replacement level. If a country is above 2.1, its population grows. Below 2.1, and over time, the population starts to shrink. India's TFR is now 1.9, below the line. To understand how wild this shift is, you have to look back a few generations. In the mid-20th century, a typical Indian family routinely had 6 or 7 children. Today, the reality has entirely inverted. We've gone from a population explosion to a baby bust in record time. Because India has such a massive cushion of young people, the absolute population will keep growing for a bit before it begins to contract. But demographers are still split on when this turning point will hit. The UN predicts we will peak in the 2060s, while global health researchers project a much steeper drop coming as early as the late 2040s. Back in the early 2000s, India's fertility rate was around 3.3. For context, that means that the average Indian woman was having more than 3 children. By 2022, the National Family Health Survey flagged that the fertility rate was falling fast. And the latest report, published by India's Office of the Registrar General last month, confirmed that it has now dropped to 1.9. So what drove this change? 3 things mainly. First is education. As more women, especially in cities and southern states, got access to higher education, they entered the workforce, married later, and had fewer children. Second, the cost of raising children. In urban India especially, the cost of schooling, healthcare and housing has gone up significantly. Having more children is simply more expensive. Third, infant mortality falling. This one is a bit counterintuitive, but what happens is that when parents are confident their children will survive, they tend to have fewer of them. As per the latest SRS data, infant deaths have dropped from 30 per 1,000 live births in 2019 to 24 per 1,000 live births in 2024. Parents don't need to have extra children as a buffer anymore. It's not just a choice either. In modern high-stress cities, couples are marrying later and facing rising rates of lifestyle-induced infertility. It's a mix of choice, cost, and biology. Better contraceptive access and women having greater agency in household decisions have also played a significant role. India's fertility story isn't uniform. The pattern is consistent. States with higher levels of education, stronger healthcare systems, and greater women's participation in the economy have lower fertility rates. Southern India got here decades ahead of the North. And according to the SRS data, rural India sits exactly at the replacement level of 2.1, while urban India has cratered to an average of 1.5. This creates an important split. While India's national average has fallen below 2.1, the northern states are still growing, and the southern states have already begun to age. To understand why this matters economically, you need to know about something called the demographic dividend. It's a window of time, usually a few decades, when a country has more working age people than dependents, more earners and fewer people to support. India entered this window in 2005. According to the UNFPA, it's expected to last until at least 2055. This dividend is a big reason why India's economy has grown so fast. A large young workforce drives production, consumption, and tax revenue. Countries such as Japan, Singapore, and South Korea all rode this wave to become developed economies. If fewer children are born today, in 30 to 40 years, India will have far more elderly people relative to working age adults. Fewer people earning, more people needing pensions, healthcare, and support. India is currently preparing for a process called delimitation, where parliamentary seats are redistributed based on population. States with larger populations get more seats in parliament. Southern states, which have lower fertility rates and smaller populations, worry delimitation could reduce their share of seats, essentially penalizing them for developing faster and having fewer children. There's also a religious angle that has been amplified in political discourse. The claim that Muslim birth rates are overtaking Hindu birth rates has been widely repeated, but the numbers tell a different story. Muslim fertility rates in India have been falling faster than any other group, from 4.4 in 1992 to 2.36 in 2021. Hindu fertility rates fell from 3.3 to 1.94 in the same period. The latest surveys show the gap is narrowing sharply across all faiths. India doesn't have a nationwide policy response yet, but some states are already acting. Andhra Pradesh recently announced cash incentives, 30,000 rupees for a third child and 40,000 rupees for a fourth. Goa, Karnataka and Telangana have set up state-funded IVF centers to help first-time parents who are struggling to conceive. A different dimension of the fertility challenge altogether. India is at a turning point. For most of its independent history, the challenge was managing rapid growth. Now, the challenge is preparing for something most Indians haven't had to think about, a country that is slowly but measurably getting older and smaller. If you found this useful, share it, because this is a story that affects every single one of us. Follow DeKoder for more such stories.